Hey everyone, I'm Lydia Ramsey. I'm a science reporter here at Business Insider. Here we are today talking with Dr. Robert Siegel. He is the co-founder of LabFinder as well as the founder of Manhattan Cardiology, a practice here in New York City. And here we're here to talk about Zika. Today is the first day of the Olympics. The opening night kicks off tonight. And Zika has been a huge worry, especially since we've been talking about Brazil and as a place of this recent outbreak in 2015, 2016. So would love to catch up with you on that and kind of hear, I guess to get started, let's talk about kind of how you've seen Zika in your practice and how you've interacted with it and kind of the things you've been hearing around the outbreak.
Good morning, Lydia. How are you?
Thank you.
And we have a very busy practice in Midtown Manhattan. And recently, especially since the outbreak in Florida a couple of weeks ago, we've had a ton of patient calls and patients coming in worried about Zika and wondering about testing, and certainly it's caused a little bit of a stir within my patient population.
Mm-hmm. Yeah, and how big of a risk are we here in New York? I mean, obviously there hasn't been any local transmission cases where mosquitoes are passing it person to person, but how big of a risk are the people coming to you? Are they likely having Zika, or maybe just a little nervous?
It's a great question.
Yeah.
I think it's not a huge risk for us here. I think we're in a climate where the cases that we see are going to be more travel-related cases. Mm-hmm. People coming from at-risk Zika-infected areas. Certainly it is worrisome if it's not controlled, but at this point, I think speaking with a healthcare specialist and knowing if you're at risk is important to know whether you should be tested or not.
Definitely. Yeah, and so I'm sure you come across a lot of different myths and stuff about Zika from the people coming in. What's maybe one of the biggest misconceptions you've heard coming through the door about Zika, and what do you usually say to bust that myth?
Well, typically women in their reproductive times of life, they're obviously worried. We see a lot of single women who worry about their future generations and worry about kissing.
Okay.
Kissing. It's there's been no documented cases of transmitting Zika by kissing.
No, definitely
so
not.
We're in New York City, and certainly a lot of kissing happens. Mm-hmm. So certainly I want to put that myth to a stop.
Right. So when it comes to Zika, the virus is mainly spread via blood and semen and urine, they think, maybe, possibly, but it definitely is carried in urine, correct? Those are the three
those are
fluids.
three modes of transmission. So obviously vaginal fluid, semen, and sexual transmission. It is, we don't consider a sexually, it's a disease transmitted through sex, mm-hmm. but certainly at this point we would carry it to say it's an STD or a sexually transmitted disease.
Right.
So that brings up another feeling of whether patients or our patients, the general population, is at risk for having casual sex. We always obviously promote safe sex for those who are having sex, and obviously in areas where the Zika infection is quite high and the prevalence is quite high, mm-hmm. You want to think about abstinence, especially in women who are thinking about getting pregnant.
Definitely. Yeah, it sounds like we have a question coming in from Facebook. Aaron, do you have that? Yeah. Okay. Yeah, that's a great question. How dangerous is it for people who are not pregnant or who have no danger of becoming pregnant?
Great question.
Yeah.
It depends what your definition of dangerous is. So if you're thinking about being a carrier of Zika, certainly mm-hmm. even if you don't consider yourself one to be pregnant and you get infected with Zika, mm-hmm. there's a certain risk of you being a carrier and infecting others.
Sure.
Especially non-infected mosquitoes. Really, we have these travel-related cases, people coming from northern South America, Central America, and they get to New York or they get to a metropolitan city and they have Zika. They don't know that they contracted it. They have no plans of being pregnant. but they themselves become carriers. So they infect non-infected mosquitoes here, and that mosquito can obviously go on and create a vicious cycle that can infect people who do want to get pregnant.
Definitely.
So,
yeah, I guess
it's a difficult question to answer,
right.
But it's a great question.
Yeah, definitely. I've never thought about the different levels of dangerous in that respect. It's interesting. So turning our attention to Brazil, I wanted to get your thoughts, kind of just how you feel about these upcoming Olympics. I mean, that's a huge international event, so lots of people traveling to a place with active Zika transmission. It's winter, so the WHO has said, no, it's not a huge deal, like we should be worried, but not too worried. What do you feel about all that guidance?
I think the importance is, in terms of looking at the statistics, I think the statistics actually underestimate the number of reported cases, because the availability of testing has been so limited in the past that we really don't know who's carrying the virus.
Right.
And if from what we know about the virus, only 20% of people who contract the virus actually have symptoms, and the symptoms are no different than a cold virus, and fever, chills, night sweats, joint pain, and you typically don't see yourself getting tested for a cold. So it really scores the value that looking at the number of reported cases and knowing if you're at risk when you go to Brazil, you have to be careful going to what generally is considered the ground zero or epicenter of the virus. So
definitely, yeah.
I would be careful.
Yeah, definitely. And so to that point, what kind of steps can people take if they're in Brazil, or if they're an athlete getting ready to compete and don't want to be struck down by a debilitating illness? What are some of the steps they can be taking?
So the first step is to prevent mosquito bites.
Sure.
How easy is that? It's not so easy. We all get bit by mosquitoes, and certainly you can prevent it. The athletes themselves, after their competition, you want to stay inside as much as possible and not be outside and expose yourself to mosquito susceptible areas such as polluted water, swamp areas, places where stagnant water does exist, and really be in well ventilated indoors, and keep yourself, insect repellent is very important, obviously, and wearing long sleeve shirts and long pants, and it's really something that you just want to be smart about it.
Absolutely, yeah. And for people coming home, I mean, in your practice and stuff, especially since you're a part of LabFinder, and I'd love to hear kind of more about that, but should people, regardless of whether they feel symptoms or not, be tested for Zika? Like, what is kind of the best practice in your perspective?
That's a great question. So you don't want to cause mass hysteria.
Of course.
But there is a certain level of what we know and what we don't know. So, up until recently, you were able to get tested through the CDC, Center of Disease Control, and Department of Health. But CDC actually has granted and expanded their commercial use of testing, Zika testing, to just general clinical labs. So that's where a company like mine, LabFinder.com, you can go right on the site, put in your zip code, and find a clinical lab that can do the testing, and you visit the test center, and you get access to your results the same time as your doctor, and you can protect yourself. So, and when I say protect yourself, you really want to know, knowledge is power. So you really want to know if, you don't have the disease, but if you do, you don't want to be a carrier of the disease. So it's really important to be proactive about your health and get tested.
Definitely, yeah. What was I going to ask? So this is a relatively new outbreak, right? Like, we've seen it before, it's been around for decades, but this is really the first big resurgence of it. What are some of the, you as a medical practitioner, what's the most fascinating part about watching this all unfold to you?
It's not fascinating, but it's sad. It's really something where these outbreaks, because we haven't had the general testing available, it's really hard to know whether we've been dealing with just a simple cold virus or another type of virus, especially in these tropical zones, that we haven't been able to diagnose because we haven't had the screening available. Now that we're having the screening available, we're able to really put our statistics at hand and really tell people whether they need to worry or not. So it's a concern. I wouldn't say I'm that concerned regarding the outbreak to areas such as New York and above the subtropical zones, but certainly you have to be we're a little bit cautious in terms of what you read and how you read it, because we just never had the diagnostic testing available. So when you go to my site, LabFinder.com, you can really find out whether you have contracted the disease and put yourself in a situation where you have a little bit of education, and you bring that to your local healthcare provider, and you can discuss the results and really find out whether you're someone who puts yourself at risk for spreading the virus to generations. And as you know, Zika has been linked to birth defects such as microcephaly, and this is just abnormal brain growth and small head growth in babies, and you have hearing loss and eye defects, and it's really a terrible disease in that facet. So I think we have to take what we know about it with a grain of salt, but really we just don't have the general testing available until now to really get to know the disease. So I would picture that in the next few weeks to few months, you're really going to have a lot more information and reason to be concerned or not to be concerned because of real numbers.
Definitely. Looks like we got a Facebook question. Do you?
Our question is from Joey. He's asking, do we know why only some people show serious symptoms?
Sure, that's a good question. Do we know why some people only show serious symptoms? Why isn't it everyone?
No, the answer is no. It's a great question, Joey. And it's certainly one of those things, like anything else, it depends on your age, your comorbidities, if your immune system is down, why some may show more severe symptoms than others. But this is a very insidious disease, and really, if you can't tell this virus from the syndrome or manifestations from a regular cold virus, then it's really very, very hard to pick up.
Definitely. Yeah, that's always been my thought. Speaking along the lines of really nasty side effects, we've talked about birth defects and how it's a big problem for pregnant women, especially in the first first two trimesters. But when it comes to Guillain-Barré, it seems like there's still a lot we don't know. I mean, that's a debilitating neurological condition. It's kind of temporary, but in some cases, it's maybe been a little bit worse than that. I was wondering if you could get your perspective on how that plays into the overall Zika picture.
So the Zika picture with Guillain-Barré certainly is, I think we're too early in the game right now to look at the long-term outlook of Zika and its link to Guillain-Barré. Obviously, there's more reported cases now of the neuromuscular disorder, and it's a debilitating disease, and it is life-threatening, and you don't want to start mass hysteria that this is going to be a direct correlation to Guillain-Barré, but I think practicing prevention, gaining knowledge, and knowing whether you're positive for the virus or negative for the virus really would give us a big, healthy head start to knowing more about it.
Definitely, yeah. I think we have another Facebook question. Great.
From CT, Michael, where can I find information about Zika testing?
Okay, so yeah, question from ZT, where can you find more information about Zika testing?
So you can go to your local Department of Health. The CDC has really good information. Our site, LabFinder.com, we have a dedicated Zika resource center that gives all the useful information about the Zika cases and what Zika is, how to prevent it, and really keeps you up to date on the latest developments, as well as the number of reported cases. So visit LabFinder.com, and I can assure you we'll keep the math simple and the explanation simple, so that way the general public can understand what Zika is all about.
Very cool. Definitely. Yeah, and I mean, one of the big questions I have, and we kind of hinted at it earlier too, is how this whole the breakout that's happening in the one neighborhood in Miami is going to play out. Like, is this, as far as you know, you mentioned it's mostly going to be a problem in the subtropics. Do you see it spreading beyond this one neighborhood in Miami? Like,
yes.
Yeah.
I mean, the idea of spread is, and you had the CDC director really talking about how to try to prevent mosquito-susceptible areas, and this could be anything where just stagnant water in an alleyway can breed these type of mosquitoes. Certainly, when you have people coming back who are infected, again, into Florida, and they become carriers and they infect uninfected mosquitoes, then you could be talking about a large epidemic that occurs because you haven't had the testing available for people who don't know that they contracted the disease.
Right.
So to answer your question, yes, this could spread. Certainly in the subtropical zones, we know that the climate is much like it is in Miami. And we found different type of mosquito species that like to come up to the northern climates and spread the virus.
Yeah, definitely. Yeah, and I actually, great. One last question.
Sure.
One of my BI colleagues had this question: how long does Zika stay in your system? Like, do we have a guidance? I know there's been a couple of different reported numbers. What's kind of the latest on all that?
Okay, it's difficult to tell you, and there's not enough data to. The CDC hasn't come out and told us really exactly what the stages of activity are in terms of how long it stays in the system. We know that if it stays, usually if you have symptoms and you have Zika and you've tested positive, you should abstain from sex and really think about staying away from people and staying away from mosquitoes that can pick up your illness within the first few weeks of knowing. But from what's coming out now, I would tell you there's not enough information. And stay tuned, because I think after the Olympics, you're going to get a lot more information on Zika and potential implications.
Great. Well, thank you so much, Dr. Siegel, for
welcome.
taking the time. This
You're
has
welcome.
been really great, and I hope you guys following along on Facebook have learned a lot. Yeah, great.
Thank you.
See you.